Hello, I'm Lynn Bickley, Associate Professor of Internal Medicine and Neuropsychiatry at Texas Tech University Health Sciences Center, and author of Bates' Guide to Physical Examination and History Taking. Patients tend to view providers of clinical care in different ways. In some instances, they look at us as miracle workers. At other times, as people to be feared and avoided at all costs. These contrasting attitudes arise primarily, I think, from a single source: the patient's previous experience with healthcare providers. We ourselves know that not all medical treatment can be successful. Patients, like all of us, are mortal, and we ourselves are not infallible. But it's not just the success or lack of success of our treatment that influences our patients' opinions about us. Quite often, it's our approach to the patients that determines how they feel. No matter how skilled our treatment or effective our prescriptions, it's our skill in relating to patients that seems to count the most, and that is a matter of no small importance. After all, studies have shown that clinicians can sometimes affect the outcomes of their patients' cases merely by the quality of the clinician-patient relationship. Over the next few minutes, I'll be discussing your approach to the patient, emphasizing the knowledge, skills, and procedures that contribute to an effective relationship and quality patient care. In few fields of human endeavor is the human touch so vitally important as in medicine. The successful clinician not only must understand how to bring science and technology to bear upon the problems of health, the successful clinician must also become thoroughly familiar with the techniques of dealing with a patient on a human level. Therefore, the successful clinician strives to be approachable, someone the patient respects and is able to confide in. This is important because successful relationships require collaboration. Therefore, the successful clinician must also be an empathic listener, able to put him or herself in the place of the patient and see things from the patient's perspective. An empathic listener understands that patients are unique individuals with unique health concerns. Get your patient's own stories in their own words. Use open-ended questions. Follow the patient's own cues and clues. And above all, listen. By truly listening to your patients and being open to both verbal and nonverbal communication, you can begin to comprehend their uniqueness and start the process of discovery that leads to effective clinical diagnosis and treatment. The successful clinician takes time for self-reflection so as to remain open to the possibility of his or her own biases. Through self-reflection, a clinician becomes aware of how one's personal viewpoint can be affected by a patient's age, social class, ethnicity, and state of health. Establishing relationships with individuals from a broad spectrum of backgrounds is an uncommon opportunity, a privilege, and a significant challenge as well. Therefore, we must look inward to clarify how our own expectations and reactions may affect what we hear and how we behave. The successful clinician is respectful and courteous. Having striven for self-awareness, the clinician is prepared to be not merely tolerant about individual differences, but respectful of them, which requires a higher degree of empathy altogether. In most cases, patients perceive you as a person of knowledge and authority. In that sense, you are your patient's host, and you should treat your guest with courtesy and with behavior that is professional. You demonstrate respect when you determine the personal space that will separate you from your patients, choosing an appropriate physical distance that promotes comfort while facilitating conversation and good eye contact. This personal space will vary in size depending on the cultural origins of your patients, and you show courtesy by acknowledging this difference and respecting it. You also demonstrate respect when you avoid arrangements that connote an inequality of power. Interviewing a female patient who is situated for a pelvic exam, for example, or seating a patient so they must face a bright light or window during an interview, are both examples of how to send a message of disrespect. The successful clinician is respectful and attempts to meet the high standards that patients expect. Professionalism means not only that one is knowledgeable, ethical, and dedicated, but also that one meets a high standard of appearance, grooming, and hygiene. The challenge, of course, is to meet these standards while remaining approachable, someone the patient is able to relate to on a human level. It all gets back to what I said in the beginning about how patients perceive us. The most effective relationships come about when the healthcare provider is neither placed on a pedestal nor regarded with suspicion. Maintaining or improving patient health and well-being is what being a clinician is all about. And excellent patient care depends on clear, effective communication right from the start, even before the history-taking interview and the examination itself. Prior to your encounter with the patient, prepare by reviewing the patient's chart. This will acquaint you with the patient's medical history and will help you to anticipate cultural differences too. But don't let the chart prevent you from developing new approaches or fresh ideas. After all, charts often fail to capture the essence of the person you are about to meet, and your treatment should be directed toward the actual patient and not toward an example from a textbook. Consider the goals of the interview. Why was the appointment made? While you should always keep an open mind about your patient's health, you must always elicit the patient's story, their immediate specific concerns. Otherwise, you risk losing the patient's confidence and therefore their cooperation, even before the exam begins. You further ensure cooperation and greatly enhance communication when you make sure that the setting for the interview and examination are as private and as comfortable as possible. Like people everywhere, patients are less likely to become distracted and nervous if they have a place to safely store their belongings, and they always appreciate a room that is at the proper temperature, particularly if they are to disrobe. So try to establish a routine of preparing for your patient's comfort before the appointment begins. Your patients will appreciate your thoughtfulness even if they're too preoccupied to mention it. Taking a patient's health history is a conversation with a purpose, and the ability to communicate and relate therapeutically with patients is one of the most valued skills of clinical care. During the interview, you will draw on many of the interpersonal skills you use every day, but with unique and important differences. Unlike social conversation, in which you express your own needs and interests with responsibility only for yourself, the primary goal of the clinician-patient interview is to improve the health and well-being of the patient. So in the interview, you will try to establish a trusting and supportive relationship, gather information, and offer information. At the beginning of each encounter with the patient, Greet the patient cordially and establish rapport. Address the patient by name and introduce yourself, giving your own name. Name tags are great facilitators of this. If possible, shake hands with the patient. If this is your first contact, explain your role in the patient's care. Never hesitate to ask how to pronounce the patient's name, and use a title when addressing the patient, saying Mr. Jones or Ms. Livingston. Avoid using the patient's first name unless you have specific permission. Greet and acknowledge each visitor in the room, but maintain confidentiality. Let the patient decide who stays in the room, and then make sure that only those specifically included in the conversation are in a position to overhear it. As an empathic listener, it's up to you to invite the patient's story. Sometimes you'll want to make small talk first as a means of helping the patient to relax. In most cases, the patient's health history will soon begin to flow spontaneously. Give the patient your undivided attention, and remember, the task of organizing this information will be your responsibility. Later, you will have to turn the patient's words into a coherent narrative. So take notes and try to cover most of your questions now in the pre-examination. That way, you won't interrupt the flow of the examination with constant note-taking. Even if time is limited, try to appear calm and unhurried, because little can be gained by cutting the patient's story short. By using open-ended questions, you allow full freedom of response. Follow the patient's cues to keep the patient at ease, using specific language and words the patient understands. Personal and social concerns may emerge at any time during the interview. As you converse with your patients, it's important to employ various techniques to reassure, encourage, clarify, and validate what the patient tells you. With experience, you'll learn to avoid some of the pitfalls of verbal communication, such as inappropriate or counterproductive statements of reassurance, or verbal facilitation that, instead of encouraging patients to talk, merely interrupts them and derails their train of thought. With experience, you'll also learn to adapt your interviewing technique to specific situations and types of patients. Whether your patient is silent, overly talkative, anxious, confusing, angry, or even crying, you must never lose sight of the importance of listening to them and clarifying their agenda. Nonverbal communication, that is, communication that does not involve speech, occurs continuously and provides important clues to feelings and emotions. Becoming more sensitive to nonverbal messages allows you to both read the patient more effectively and to send messages of your own. Pay close attention to eye contact, facial expression, posture, head position and movement, such as shaking or nodding, interpersonal distance, and placement of the arms or legs. Your posture, gestures, eye contact, and tone of voice can express interest, attention, acceptance, and understanding, or, conversely, boredom, impatience, disapproval, and lack of understanding. Moving closer or engaging in appropriate physical contact, such as placing your hand on the patient's arm, can convey empathy or help the patient gain control of feelings. Be non-judgmental. Avoid reactions that betray disapproval, condescension, or embarrassment, or that tend to stereotype, criticize, or belittle the patient. Bringing nonverbal communication to the conscious level is the first step to using this crucial form of patient interaction. Establishing a supportive interaction through both verbal and nonverbal means enhances information gathering and itself becomes part of the therapeutic process of patient care. Patients often view the actual physical examination with concern. They feel vulnerable, physically exposed, apprehensive about possible pain, and uneasy about what the clinician may find. At the same time, they appreciate the clinician's concern about their problems, and they respond to your attentiveness. The skillful clinician is thorough without wasting time, and systematic without being inflexible. During inspection, palpation, auscultation, and percussion, examine each region of the body, but remain sensitive to the whole patient, noting each wince or worried glance, and sharing information that calms, explains, and reassures. Tell the patient when you are moving from one segment of the examination to the next. Throughout the examination, be gentle, but don't be afraid to cause discomfort when it's warranted. Earlier, I spoke about the importance of courtesy. During the examination, you demonstrate this in many ways. For example, simply by washing your hands in the presence of the patient, you show respect right from the start, which helps set the tone for the remainder of the examination. When examining the abdomen, warm hands and a warm stethoscope are minor but significant reassurances of your intention to do no harm. Likewise, avoid long fingernails and offensive colognes or perfumes, and always remember to observe the patient's face closely for signs of discomfort. Your approach to the patient should also minimize the number of times you ask the patient to change positions. This not only saves the patient from an inconvenience, it also reassures the patient that you are a trained, decisive professional. You send the same message of courtesy and authority when you are clear and unambiguous in your directions or explanations. If you leave the room, make sure your patients know if they are to wait or whether they are to get dressed and return to the waiting room. Few requirements of the examination distress patients more than the need for them to disrobe or change into a revealing gown. That's why attention to proper draping technique is so critical to your relationship with your patients. By demonstrating that you respect the patient's privacy and personal space, you instill confidence and promote collaboration. Draping technique differs slightly between male and female patients. However, with either sex, you'll want to develop a routine that's in sync with your sequence of examination. It's essential that effective draping and consideration in how you adjust the patient's gown become second nature. Throughout the examination, try to remain aware of the patient's feelings and extend this empathy to other privacy issues as well. Assert control over room access during the examination to prevent casual or unwarranted intrusions that might cause the patient distress. Even a seemingly minor intrusion or some other momentary loss of privacy can shut down all cooperation by the patient, with lasting ramifications to the relationship. Rectal and genital examinations are best performed at the end of the head-to-toe examination for this very reason. The examination and the associated questions are often perceived as intrusive, and patients subsequently become anxious to complete the examination, get dressed, and depart. As a professional, you owe it to yourself, your organization, and most importantly, your patients, to observe your facility's policies on issues such as third-party attendance during sensitive examinations and confidentiality of records, to name just two of the many issues with serious legal ramifications. Over time, The laws and regulations that serve both you and the patient tend to evolve, and a key ingredient in your approach to your patient is to always be aware of and adhere to the rules that govern our profession. By serving them, you better serve your patients. Few clinical techniques are as critical to a successful relationship as how you handle the discovery of positive findings. As a beginning clinician, be judicious whenever you consider sharing findings with the patient. After all, you are not the patient's primary caregiver, and your views may be conflicting or in error. As you grow in experience and responsibility, sharing findings will become more appropriate. If the patient has specific concerns, you may even provide reassurance as you finish examining the relevant area. Be selective, however. If you find an unexpected abnormality, you may wish you had kept a judicious silence. And if you discover abnormalities such as an ominous mass or a deep oozing ulcer, avoid showing distaste, alarm, or other negative reactions. Whether you find an abnormality or not, there will be occasions when you will spend an unusual amount of time on one area of the examination, enough time so that the patient might become alarmed. At such times, a few words of reassurance may be all it takes to set the patient's mind at ease. Finally, remember that your relationship with the patient will be ongoing. Reassure the patient that you are committed to continuing care and that you will follow up on any concerns. It's sometimes easy to forget that patients have a life beyond the examination room. Their own medical care, no matter how critical it may be, is not always their first priority. They look to us as healthcare professionals for leadership and understanding. At the same time, we can forgive our patients if sometimes they believe that their own particular case should occupy our every waking moment. So in your approach to the patient, try never to forget that each and every patient is unique and important, deserving of all our respect as well as all our skill.